President Obama and Republican leaders going head-to-head on Capitol Hill over the fate of Obamacare. Republicans vowing to make quick, sharp changes and scrap the current law. Listen to this.
The first order of business is to repeal and replace Obamacare. We're also working on a series of executive orders that the President-elect will put into effect to ensure that there is an orderly transition during the period after we repeal Obamacare.
So what does an immediate repeal without an immediate replacement mean for you and your family? Here to weigh in on this is radiologist Dr. Nicole Saphier. Hey, Dr. Saphier, thanks for being with us again.
Good morning.
Good morning. So you heard Mike Pence saying wants to repeal immediately. We've all heard that and we know that. What if they repeal it and don't have an immediate replacement? What happens?
Well, without a doubt, something momentous is brewing in Washington right now. Come January 20th, something will be done to repeal Obamacare. Whether it's executive order by President-elect Trump, I feel that'll be a little bit more symbolic rather than substantiative, because the majority of the repealing of the ACA will need to be done by legislative action, which has already started. We've already introduced a budget reform, which will begin the process of repealing the ACA. Now, to be clear, that's not necessarily going to be repealing the ACA, but by removing the funding, we're going to accelerate the downward spiral that the ACA already is in. So what will happen essentially without the penalties and mandates, there's no guarantee on the subsidies and the tax credits. Therefore, the few remaining insurance companies in the marketplace are going to quickly be pulling out, leaving patients with fewer coverage options. And worst case scenario, we could have a collapse of the insurance market, which would potentially lead us for a possible bailout from a federal level.
That's pretty scary. All right, so as a physician, you talk to your patients, and dealing with cancer, I mean, you don't turn patients away, I'm sure, and you're dealing with Obamacare. What, in your opinion, does Congress need to do to change it, make it better for everyone and for the American people?
Well, the good news is we're not starting from scratch. We have about 7 Republican proposals already ready to go right now on what we can do to replace the Affordable Care Act. A part of it is we need to be giving states a little bit more individuality. I mean, we are a diverse nation. What's working in California are some of the provisions of the ACA. Next door in Arizona, the patients are drowning in these skyrocketing premiums in this unsustainable system. So we need to, by having block grants when it comes to Medicaid and other provisions, you're going to give the states a little bit more freedom to use their diversity and how the funds should be. In terms of a big change from the Republican proposals as opposed to the ACA, what we're going to be doing, you're going to see the premiums based on age, not necessarily on their income status.
So a 22-year-old's not going to pay what a 60-year-old pays.
Absolutely, and they shouldn't. They're not needing medical care from the majority of the time the same way.
But can it still be sustainable then? Because if the 22-year-old's not paying what the 60-year-old's paying, they're losing money.
Who's losing money?
The government or Obamacare.
Absolutely. And so this is all the intricacies that the government is trying to deal with right now. But what we will be seeing is right now in the Affordable Care Act, these young 20-year-olds aren't enrolling. They're far below where President Obama thought that they would be. So they're not even enrolling. So the people who are enrolling are the sick and more elderly, and everyone's paying for it.
Right.
Now, what we will see in a lot of the Republican proposals is the popular provision of the pre-existing conditions. But there'll be a caveat to it. So meaning if you have cancer and you're on your employee-sponsored plan, but you want to go on your own individual plan, as long as you go from one to the other, that second plan has to treat you the same. They cannot take your condition into consideration. They can't charge you more. However, if there is a lapse in coverage, they will still be required to offer you coverage, but possibly at an increased rate.
All right. Well, they're going to have to look at all the plans and figure something out.
They have 2 weeks.
Thank you, Dr. Saphier.
They need to do it.
I know. Thank you for joining us.
Thank you.